Hi, I'm Gary Bebow. I'm the CEO of WRHS System, and this is our April CEO Connection. With me today are the three orthopods that practice at White River Medical Center. I can speak on behalf of the White River Medical Center and the whole North Central community. We are so fortunate to have these three guys practice here. And so I wanted to introduce them. For those they really don't need any introduction, but I want to introduce them, and I want them to talk a little bit about their practices here. In August of 2013, Dr. Carpenter, on my far left, joined us right fresh out of UAMS residency program in orthopedics. He's been here, as I said, about a year and a half, and he really brought to us that minimally invasive hip surgery that so many patients have really benefited from here. So, Dr. Carpenter, as an employee of the hospital, we're really proud to have you here. And why don't you tell me a little bit about what's happened this last year and a half that you've been here?
Well, it's been an exciting year. Started in August of 2013 and was just really welcomed by the entire staff and as well as the hospital. Been provided with all the things they need to get started. And one of the great things that we brought here to WRHS is a minimally invasive total hip procedure, which just allows patients to get to recover quicker, to get up and to get going faster, and to kind of restore their quality of life a little bit quicker than we used to be able to do. So that's been a real blessing for me and hopefully for the community as well.
Well, we're sure glad to have Dr. Carpenter here. I can tell you from, like all three of these guys, I hear so many comments from patients and staff members about the interpersonal skills and just the clinical skills that these guys bring. Now, to my more immediate left, we have Drs. Allen and Dr. Angel. Now, Dr. Allen joined us in 1982. Dr. Angel started in 1993. And over that period of their tenure, they've been pretty much, well, they have been independent practitioners, but yet over the last year or so, they started considering becoming an employee of the hospital. And so in January of this year, Drs. Allen and Angel became employees of the hospital. So I'd like to ask these guys to talk a little bit about their tenure here at the hospital and some of the decisions or reasons that the decision to become employee, why they made those. So Drs. Angel, Allen, why don't you guys talk a bit about what you're thinking is there?
Well, I think it's very important to say what a great partner I've had here. Been here 20 years, and working with Dr. Allen in a small business has really been gratifying. However, through time, the business model of medicine has changed, and there's lots and lots of regulations, lots of things we have to do from the business side of medicine that's becoming challenging for a small practice. So for those reasons, we decided to collaborate and join the hospital and get some more expertise in the management side of our business practice. Since we've joined, it's been smooth. The clinical operations, you can tell there's been no effect from taking care of patients daily and the patients in the hospital. But from the business side, we're already starting to see some collaboration and expertise from the management side that they bring to our practice. So we look very forward to continuing that relationship. And we're excited with the change in healthcare, and the new changes in healthcare reform require providers and institutions to work closely and to try to increase value for patients by decreasing complications, readmissions, and increasing patient value. So we look very forward to continuing that relationship.
I've been very fortunate in two forms. One was to move to this little community a long time ago. It doesn't seem like it's been that long, but it has, 33 years as of this summer. My best talent really has been picking partners, because I've got two of the best orthopedic surgeons in the state as my partners. They're really good people, and they are exceptionally good doctors. I think that's one of the things that really has made the practice of orthopedic surgery in this part of the country so really rewarding. As Dr. Angel said, though, times change, things change, and we got to the point where we recognized the need to partner with our institutions, in particular with White River Health Systems, to survive in today's economic environment. the practice of medicine, particularly in orthopedics as well as everything, really has changed so drastically over the course of the last 5 or 6 years that we felt now was the time to do something. And fortunately, the hospital felt the same way. What the goal is really for us is to continue to be able to practice the type of orthopedics that we want, that we feel like we have to provide for the people of this area, and at the same time to assure the people of this area that we'll have continuity down the road in terms of being able to attract younger orthopedic surgeons. We really want to continue that mode of having the chance to take our time, recruit good people, hopefully at some point to replace me in the not too distant future, but certainly to keep the quality of care going. These two guys next to me are unbelievably good doctors, and I think probably for us to have them here and for them to join this community has been a plus that is going to be celebrated for a lot of years to come. Mr. Bebow and I have fairly parallel years here. He came a little bit after I got here, but by the same token, he's seen things change as have I. And recognizing change and not waiting too long to make them, I think, has been a key. I'm just happy to be here, and that's all I've got to say.
Well, we're sure glad to have these guys. You know, most assuredly, the future of healthcare will require all of us as providers of healthcare to work closer together to the benefit of the triple aim, which is lower costs, greater access, and greater quality of care. And so I really look forward to the future working with these three guys in towards those goals. And welcome aboard, guys. Glad to have you.
Okay. Thank you, sir.
Yeah, I really appreciate them coming in today and sharing with us some of their thoughts and things that they're doing here at the hospital. Clearly, all of us are so fortunate to have physicians of that caliber not only practice in North Central Arkansas, but be a part of the White River Health System staff. So I really appreciate them being a part, and welcome aboard. The standard of the month for April is commitment to coworkers. You know, all of us are so reliant on others in the hospital that help us do our jobs better. And so for this month of April, I want you to be particularly attention to the importance of our commitment to each other. You know, whether it's new employees at the hospital and making them feel welcome, or it's just do the right things and helping each other to be better and have the hospital be better in our services. So during this month of April, let's pay close attention to being committed to each other's success. So that's our April standard of the month. I'm really proud this month to recognize Cheyenne Cairns as our Employee of the Month at White River Medical Center. She's been here about 5 years, and this week I went up to the ICU and spoke to physicians and staff, and Cheyenne is well known for her courtesy in interacting with other staff members and patients and families, and it was a unanimous choice that she should be nominated for that award. So when you see Cheyenne, be sure to recognize her and congratulate her on that award. Over in Stone County Medical Center, Robert Lucy was selected as their Employee of the Month. Robert's been at the hospital around 14 years, works mostly the night shift, and just like Cheyenne that I spoke of earlier, he's really well thought of up there. So Robert, please recognize him for his services at Stone County Medical Center and this great recognition. On April 7th, the medical complex will host the business after hours for the Spring River Chamber of Commerce. An important part of the business after hours is the recognition of Dr. Charles Tucker for 50 years of service in the North Central Arkansas area. If you're in the Highland area on April 7th from 5:30 to 6:30, I hope you'll stop by and congratulate Dr. Tucker for a terrific career in medicine, and he has provided such great care for people in that area that he really deserves our recognition and time going to the business after hours. So please put that on your calendar and attend if at all possible. National Healthcare Volunteer Week is April 12th to 18th. You know, all of us at White River Medical Center, Stone County Medical Center, and the medical complex are really fortunate to have a great group of volunteers. you know, whether it's their interaction with visitors or guests or patients, they really make a difference on how people perceive us and make us better. You know, whether it's the month of April, the full month of April, or particularly the 12th or the 18th, pay close attention to our volunteers. Each month we do a community education event, and on April 14th at noon in the Josephine Ray Rogers Center, Dr. Gonzalez will speak about sleep disorders. In February, I heard Dr. Gonzalez speak at another event, and she really provides a great presentation. And I hope that you'll come out and listen to Dr. Gonzalez talk on April 14th at noon, and free lunch will be provided free, and I think you'll really benefit from her presentation. By now, you should have received communication regarding the organization change that will take place April 1st. If you have any questions regarding that, I hope that you'll contact your manager to get further clarification. As I've said in the previous communication, that this is a real big undertaking. I know it'll take some time. I know that it'll be challenging in many ways, but I'm also very convinced that in the long run, this will be a very good thing for all of us. So, as in the past, if you have any questions or suggestions that we can make this video better, more meaningful to you, I hope you'll follow the directions that follow this clip and give us a benefit of your feedback. So thanks, and I'll see you around the hospital.